Hi, I'm Mark Opauszky. I'm CEO at Sparrow BioAcoustics. I play drums and about 15 other instruments quite badly.
Mark, can you tell me a little bit about why you started Sparrow BioAcoustics?
Actually, Sparrow BioAcoustics was started by a group of founders. I came in just a little bit later.
Okay.
Originally, the company was the combination and the brainchild of a product person, a doctor, a software person, and a bioacoustician. And they brought together all these different disciplines and several years of research and this sort of deep belief that they could do something with this technology to help a lot of people.
Hmm.
And they did a lot of fundamental work. And then after a couple of years, while the company was still extremely small and basically still just an idea with a lot of research and some assets, I got the opportunity to join as their CEO and try to work with the team to turn this into a not just a product but a business,
Hmm.
hopefully a movement, hopefully something that'll help a lot of people.
And so, did you have a particular health background or an interest in the particular area?
Well, me personally, I mean, when I was growing up, I always wanted to be a doctor.
Uh-huh.
And I didn't make it. I became an engineer.
Hmm. Hmm.
Um, but I studied a lot of biomechanics and bioengineering. I was
Yeah.
interested in biomaterials.
Hmm.
I was interested in all these things for a long time.
Mm.
My career didn't go that way. I went in very different directions. Um, and then I got to the stage in my life where I started getting more interested in doing something that we could apply to people, to
Hmm.
the public at large,
Yeah.
something that mattered,
Hmm.
something that could change people's lives, solve a big problem.
Mm.
Um, 5 years ago, I got sick, and it was quite bad for a very long time. And I'm happy to talk about it,
Mm.
but that also really changed my perspective about what it means to be ill, what
Hmm.
it means to work with a group of people that are trying to help you, or in my case, trying to save my life,
Mm.
and how you participate in that. And I became fascinated with this idea of what is it like to be a patient? What is it
Mm.
like to be a healthcare consumer, which we all are in one way or another?
Hmm.
And what can we do to improve things for people
Mm.
who are engaging in the healthcare system, not just necessarily giving tools to doctors? So my angle on this was I didn't know a lot about medicine, but I knew a lot about being a patient.
Mm.
And turns out a lot of the folks in our company that have come here since then have had similar experiences. They've
Mm.
either been sick themselves in
Mm.
some very big way, or they've had to care for people who have.
Yeah.
And I think that's a really interesting thing that sort of unites everybody into a mission around the company.
After your recovery,
Yeah.
how did Sparrow come about? What was
You know,
that? What was that journey?
I spent 2 years learning how to walk again, how to get my strength back, how to put things back in order for myself,
Hmm.
and my children were still fairly young, and I was spending time with them, and I was at home, and you get the itch to go out and do something.
Hmm.
I'd done a couple of companies previous to that, and those had turned out quite well. And then one day I get this call from a friend, a colleague, who had met the founder Nadia at Sparrow,
Hmm.
and said, I'm looking at this company. I'm really intrigued. Would you would you go talk to them and tell me what you think?
Hmm.
And so I met with Nadia on a conference call a couple days later, and I did some research and looked into what they were doing. And
Hmm.
she was talking about stuff and just very charismatic and very driven. It's hyper intelligent person. And I was like, wow, you're really neat. Um, and and I remember thinking to myself, this is the craziest idea I've ever heard in my entire life, which is what I told my friend. I said, this is the nuttiest thing. Um, and really what happened at the end of the day was the more I thought about it, the more I was attracted to the idea. And then I had to I had to go ask my wife permission to do another startup because I said no more startups.
Yep.
And I
Fair
was like,
enough.
honey, how would you feel if I did another startup? Because this thing just showed up,
Yep.
and and it could be big,
Mm.
and it could affect a lot of people.
Hmm.
There's a lot of work to do, but it could be huge. And I remember thinking to myself, these sorts of opportunities, they only come along once or twice in your life.
Hmm.
And yes, it was early, and yes, there was a lot of unanswered questions, but just the opportunity to even get a chance to work on something like this,
Hmm.
you know, with people who had already, laid some pretty good foundations, years of research, real thinking,
Hmm.
everything else, and to be invited in, not just to join them,
Absolutely.
but to be their
To
CEO.
lead them. Hmm.
This is an incredible thing.
So I'm curious. Can you tell me a little bit about what Sparrow is currently working on?
Hmm. Well, where to begin? We um, figured out how to turn smartphones into medical grade stethoscopes,
Hmm.
which on the surface sounds like, well, why would you want to do that? Well, the reason you want to do that is because there's 3.8 billion smartphones on the planet.
Hmm.
What if they could all become cardiac scanners, medical grade cardiac scanners?
Yep.
Heart disease, lung disease, these are the top world's killers. They're progressive diseases. They often progress silently. And if we could provide more screening at a population level
Hmm.
inexpensively in a scalable way, that could change fundamentally a lot of the statistics around these sorts of things.
Hmm.
So we successfully did that. We got clearance from the FDA to do that initially for doctors to use, and then miraculously we got clearance for it to be used by people. A
That's no small
stethoscope.
feat.
It's a thing. Stethoscope is a class 2 medical device, and you have to have a certain company with a certain set of quality systems and a certain
Hmm.
level of testing, and it's not a small thing to get FDA clearance for something like this, particularly when there was no clear existing product that we could follow. No one had ever turned a smartphone into a cleared FDA stethoscopic device before. We were the first ones to ever do this and get cleared for it. Of course, the thing about stethoscopes historically
Hmm.
has been that humans interpret the sounds.
Yep.
And depending on the quality of your training and the quality of your ear,
Hmm.
and even your own physiology, you may or may not. Two doctors may or may not perceive the sound the same way.
Hmm.
So
Okay.
there's traditionally a level of subjectivity to what are they actually hearing.
Hmm.
It's difficult to train. It's hard to get beyond the basics. And we got interested in this idea that machines could help with this,
Hmm.
that we could take all these cardiac signals, all these cardiac sounds that we're taking in from everywhere because we have this distribution network with the phones, and we could make them machine readable. What we can do today, and the product that has been recently approved in Ukraine and hopefully will be approved in the US, um, makes a recording. It uses audio algorithms to enhance the relevant parts of the sound,
Hmm.
the heart signals in particular, so that they're easier for doctors to hear.
Hmm.
It creates a cool sort of graphical output, so what you can't hear, you can see. There's sort of a
Hmm.
spectrographic output that you can see the sounds go by if
Yep.
you're not quite sure if you heard one or not. And then it checks for quality, and then it checks for medical conditions. It checks for the presence of a murmur, and it does things like graph your cardiac cycle. It talks about if you've got certain types of arrhythmias or not.
Hmm.
So these are the basics, and it shows that to the consumer right
Hmm.
away. Here's your report,
Yep.
and then our view is take this to your doctor, share this with your doctor.
Mm.
Going forward, the sort of interesting, sort of ethical question
Yep.
is how much information do you show to people?
Hmm.
If you think you have a 92% chance that this is a pathological murmur and you were unaware of it before,
Hmm.
is that something that you want to tell a person? Is that something you want to tell their doctor? Do you just want to provide enough information so the doctor can potentially confirm that, and then once it's confirmed, say that?
Hmm.
Because even at 92%, which sounds very accurate, 8% of the time, something's not gonna be quite right.
Yep.
It was gonna be
Absolutely.
a false positive or a false negative.
Mhm.
So we want to study this in more detail, and this is something we'd like to really get good at as a company, which is, providing people with actionable medical information that they can use to get better care
Mm.
sooner and faster, but not providing them information that's not helpful,
Mhm.
things that still need to be confirmed by other tests and so we have several tests because they sort of overlap and they create these
Yep.
sort of confirmational situations. So that part's a work in progress. We're doing the basics now,
Mm.
things that we think people need to know right away. Going forward, we're gonna do a lot of tests, work with a lot of people, see what works for them the best, see what does the most good.
Mm. Yeah, absolutely. Can you tell me a bit about Sparrow's relationship with Newfoundland and Labrador?
Oh, well, we consider ourselves a Newfoundland company. We have staff on the other coast in Canada. We have staff in Toronto. We have staff in Poland, in Ukraine, in a number of countries. We have people in the U.S. So we're a distributed sort of group of people.
Mm.
And then when you say, well, where's your home going to be? Because if you want to pick one,
Mhm.
um, this was it. It's a great place to hire people. Um,
Mm.
it's a wonderful place to come and gather everybody to have meetings. We love it here. We found the government assistance programs here to be incredibly accessible.
Mm.
We found it to be very friendly, tech-friendly place.
Yep.
Um, the quality of the hiring pool is excellent, and sort of from almost day one, we were like, you know, we're a Newfoundland company.
Mark, thank you so much for your time today and sharing about the Stethoscope and all the other exciting things that you're doing with Sparrow. We can't wait to kind of get our hands on it or our hearts on it and learn a bit more.
Thanks for having me.